So, for intramuscular injections, when we give them in the neck, we want to avoid hitting the cervical vertebra. And hopefully you all know the cervical vertebra start up here and then migrate down to the lower part of the horse's neck and come into the shoulder. So we have an area above the cervical vertebra, but we also want to be below this nuchal ligament, which is very hard, very strong connective tissue. So this center area is all muscle. So we have a triangle about like that we can inject into. So you always want to visualize that area. And there's two ways that I know of. I'll go ahead and clean a spot for her. See, she's a little dirty. Two ways that I have seen that you can insert the needle into the skin. One is a slow method where you would maybe grab a hold of the skin and pinch it a little and vibrate it and just go straight in with your needle. And the other is the punch method. And the punch method, again, since we have a Luer lock, it's a little bit harder here. But the punch method takes a little practice. You would hold the needle between your fingers, between your thumb and your index finger, and you're going to punch the horse with the heel of your hand. Just like that. Attach the syringe. Now's the most important part. You have to check for blood. Pull back a little. If you see no blood, you can inject. Pull out. I always put a finger over the hole just to make sure nothing leaks back out, and you're done. The reason why you want to check for blood is sometimes you're injecting something that might not belong in the bloodstream of the horse. And the most common example of something you don't want to inject into the blood is procaine penicillin. Procaine is a tranquilizer, and it will cause the horse to have a seizure-like event. The horse will collapse to the ground. It's a scary thing when it happens. I've had it happen to me once, and it's just a very scary event. So you always want to check and make sure you're not accidentally in blood. If you pull back and saw some blood come into the syringe, you want to pull the needle out and go into a different site. So are there any questions about an intramuscular injection? Everybody's okay? That one's the easy one. Okay, you can stop.